Bismillahirrahmanirrahim. Dear viewers, good day again. This is the continuation of NCCN COVID-19 resources for the management of the breast cancer. This is the last slide, which NCCN actually provided recommendation for the supportive care of breast cancer patients. NCCN believe that endocrine treatment can be continued. It's safe and that can be continued throughout the COVID-19 pandemic crisis. NCCN recommends that LHRH analog such as leuprolide, goserelin, or triptorelin can be used every 3 months instead of once monthly, and home administration is an option that really minimizes the encounter of the breast cancer patients and the healthcare workers and reduces the number of visits of the cancer patients to the cancer centers. That really minimizes the exposure of the cancer patients and the healthcare workers to the COVID-19. NCCN has also recommended to use growth factor support. Generally, we know that filgrastim or the GCSF is recommended as a primary prophylaxis with those kind of regimens which are known to cause febrile neutropenia in more than 20% of patients. But NCCN has recommended that filgrastim or GCSF can be used upfront even with those regimens which are known to cause febrile neutropenia in less than 20% of patients. In order to minimize the risk of febrile neutropenia, because when patients are neutropenic, they are immunosuppressed. So then, if they contract COVID-19 infection, they can have a severe events with the COVID-19 infections. For the bone modifying treatments, which is bisphosphonates and denosumab, NCCN is recommending to defer the bone modifying treatment for those patients who have bone metastasis if they do not have hypercalcemia. So for those patients who have no hypercalcemia or who are on adjuvant therapy, NCCN is recommending to defer the bone modifying agent. Well, I think we have another recommendation from the Saudi Oncology Pharmacy Assembly to use bone modifying agent bisphosphonate and denosumab every 3 months because there was a CLGB study which compared every 12 weeks zoledronic acid versus every 4 weeks zoledronic acid, and there was no difference in terms of the skeletal-related events. So, hence, bisphosphonates and denosumab can be used every 3 months instead of once monthly without having any significant difference in the skeletal-related events. Thank you.